Another question. I would request the esteemed panel to opine about the pros and cons of, I think, HIIT versus LIIT, HIIT versus LIIT, in brackets, duration, frequency, etc., especially in those over 50, which is me, and want to optimize heart health versus weight loss. Who's up for that one?
I can answer that. So HIIT stands for high intensity interval training, and I assume LIIT stands for low intensity. So here's a very simple piece of advice. I would not recommend someone go straight into HIIT. It's become a fad these days across a lot of different high intensity programs. You can do it only if you have a good solid base of low to moderate intensity. Otherwise, you'll end up injuring yourself or hurting yourself. So if you got a nice base of regular moderate intensity exercise, and then you want to do HIIT once in a while, that's totally fine. It's shown to help with things like fat burning, raising your VO2 max, but you need a good baseline first.
Shall I add a little bit to that from the
John? Yes.
cardiac patients? When we look at the research around this, we have to remember that in the research settings, people have been observed very, very closely. And also the people that want to do it have volunteered to do it. And so there's a safety element to determine with the high intensity training. The other thing is, behaviorally, is it something that people are going to continue with? For most exercise, for most people, not the 20% who are athletically minded, but for the 80% of the population, for most of them, they have to enjoy what they're doing. Doing HIIT, it's a bit like going on a diet. It's not that enjoyable. It serves a purpose for a while, but can you maintain it?